everyone. In our commentary, we discuss direct-to-consumer pharmacogenomic testing. We talk about what tests are available and how healthcare providers may encounter these in their routine practice. We think it's really important that providers understand their clinical utility limitations when confirmatory testing is needed, and what resources you can go to aid in the interpretation and applications of pharmacogenomic results and guiding prescriptions for your patients. My name is Dr. Philip Empey, and I'm an associate professor at the University of Pittsburgh. And on behalf of our author group, I'm really excited to present our paper, When Patients Present with Direct-to-Consumer Pharmacogenomic Test Results, that'll appear in the February 2025 issue of the Proceedings. Pharmacogenomics is the use of genetic data to tailor medications. There are well over 35 guidelines that direct how to use genetic data to guide prescribing, and great guidances from the FDA and gold standard resources like the Clinical Pharmacogenetics Implementation Consortium and Pharmacogenomic to guide dosing. In our paper, we talk about why we think it's really important for providers to understand what direct-to-consumer testing is, where there's clinical utility, and where there are limitations with this type of testing, when it's necessary to order confirmatory clinical testing, and where to find those great resources that help you interpret and apply those results to patient care. Our paper is a commentary. It discusses what to do and provides an awesome algorithm that will walk you through the steps as a patient brings in these results to your clinic. It'll specify and talk about things like whether the test is a clinical test and whether it can be used in clinical care. There are some direct-to-consumer tests that have achieved FDA authorization that allow the use in practice, but there are many others that have not achieved this. Similarly, some tests have wonderful coverage of all the necessary alleles that should be tested, while others may have some gaps. So we talk about these things and how you know whether something is a good test that can be used or what needs to be clinically confirmed. Importantly, we also direct you to resources. If you're not so aware about pharmacogenomics, we direct you to maybe the pharmacist you're working with that may have some expertise in the area, or where you can get those resources. Again, the Clinical Pharmacogenetics Implementation Consortium, or CPIC, is an awesome resource, as well as the Pharmacogenomics Knowledge Base, or Pharmacogenomic. When a patient provides these results to you, we encourage you to first and foremost understand why they're bringing the results to you, what questions they have about their drug therapy, and what brought them to seek this testing in the first place. From that, we may understand what's going on and why they may have drug-related problems, and may help direct us on whether we need to repeat that testing or not. From there, we're going to understand whether the test is able to be used clinically, whether it's a clinical test authorized for clinical use, or whether it needs to be repeated, whether the recommendations that apply to the results that they may have are at an appropriate clinical level to be able to be used in clinical practice. And then we talk about where it's necessary to document the results in the medical record when all those criteria are met. Pharmacogenomic testing are a lifelong result and something we really should be placing in the medical record if we're using it to guide clinical care and if it's an FDA authorized or clinical test. So we do think you'll see direct-to-consumer testing. We invite you to review our article. Again, When Patients Present with Direct-to-Consumer Pharmacogenomic Testing Results, and we hope it's useful to your practice. Thanks for your attention.
We hope that you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel, www.youtube.com/Mayo Proceedings, or journal updates on Facebook, www.facebook.com/Mayo Clinic Proceedings. You can also follow us on X, formerly known as Twitter, available at Mayo Proceedings. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This content is copyrighted by Mayo Foundation for medical education and research, published by Elsevier Incorporated. All rights are reserved, including those for text and data mining, AI training, and similar technologies.